So the topic I'm going to discuss is mommy wrists. There's actually something called Dequervains Tenosynovitis. If I can fit it all down here, Dequervains Tenosynovitis. And I think we'll just stick with mommy wrist. The bottom line with this pathology or this problem is that when I have a patient that comes in saying they've been having a couple weeks of pain, especially lifting the wrist up or going in this position, typically you'll see this in moms, especially when the child or infant hits about 3 to 4 months of age. At that point, most babies will have pretty decent head stability, good back muscles, so that you can lift up the child this way and have the child face you. Until that point, you always have to support the back, so it might just be a one-sided problem. It can be the action of the baby. It can also be the action of these car seat, stroller combinations, rocker combinations, where the handle is just beefy for any activity. Well, that's a lot of work that you have to use one single handle in at different heights, depending, or getting into a small car, and that can cause a bunch of havoc with the wrist. And it's not just a 6-pound, 10-pound baby, it's the whole weight of everything included. So the idea with wrist pain, the bottom line with wrist pain is that the most important thing as far as medically ruling out disease in the patient is to make sure there's no problems with bone. In this pathology, there's usually irritation of the tendon as it passes underneath this sheath. I put the retinacular, this sheath, right here. There's an illustration. I think you can see it, hopefully. And it's a tight sheath. It's mostly ligamentous tissue. Ligamentous tissue is like a tough piece of steak. Hard to chew, really tight, no meat, no muscle on it. Well, that ligamentous tissue is meant to go around the wrist like this. There's a flexor retinaculum and the extensor retinaculum. Extensor is much smaller, but this is all made to keep the tendons of the wrist from bowstringing. If you didn't, then when I went like this, the muscle and its tendon would come straight up, and that would be a bowstring. Or the muscle here and its tendon, if I contracted like this, will come straight out, and that's obviously not practical, so you have a tight band. It's not tight so it chokes off the blood supply or pinches off the nerve, but it's tight enough so it keeps everything tidy. The problem is if it stays at its usual circumference or its usual length, but yet the tissues become swollen, like in a mom who in 9 months can gain some weight from pregnancy, or can have some water weight shifts in size of small compartments. There's a small compartment here called the carpal tunnel syndrome. A lot of moms will get carpal tunnel syndrome, numbness and tingling to these 3 fingers with the 3rd trimester of pregnancy. Well, this is usually after birth. After giving birth, the pain starts up. Again, it doesn't have to be with the mom. It can be with a painter. It can be with somebody working with tools. It can be with, my hairdressers get it a lot when they're blow drying or trying to work with hair. So the tendon that goes along the thumb and is responsible for extension of the thumb has to fit underneath this retinaculum so it gets down to the muscle. So again, the tendon has got to fit past this tight band of tissue to get to the muscle. When the muscle shortens, it pulls on the tendon like that. And if there's no swelling and there's just enough room, the tendon right here will slide under the retinaculum with no problem whatsoever. As you gain weight, that becomes relatively compact. And if there's a little bit of friction with a lot of more activity than usual, a little bit more friction than usual, it will cause irritation. And what happens when you have irritation? If you're my patients, you know you have inflammation. Inflammation causes swelling, and suddenly that space that was really tolerable to movement doesn't tolerate movement anymore and actually gets tighter and more painful. So you'll have a logarithmic increase in pain and inflammation until finally a patient just doesn't want to move it anymore. Or they try medicines, it doesn't work. Now, a lot of moms who are breastfeeding in their first 6 months of taking care of newborn, they don't want to use any anti-inflammatories. The only anti-inflammatory that is proven to not cause any damage to the child in the breast milk has been Motrin. So you can go up to 800 milligrams of Motrin 3 times a day if we're going in that direction. Sometimes if you're not breastfeeding, or if you can what we call pump and dump, that means pumping the breast milk but getting rid of it so that you can just have the action of the breast still make milk while you're using medicines to take down and decrease the swelling. if you can pump and dump, we can use different anti-inflammatories of a higher intensity or bigger bigger gains as far as anti-inflammatory effect. With any kind of bigger gains will come bigger side effects though. So again, if you can tolerate it, we'll do it, even to the point of steroids by mouth or a steroid injection into the sheath to bring down inflammation quick. It depends on how much the patient, the mom, is suffering or the worker is suffering. If it's tolerable, then we actually will immobilize and use conservative treatment, which could be immobilization with a thumb brace. This is a very small thumb brace. It just works on the wrist, and if it doesn't fit properly, you can have a lot of motion that still is not good. Sometimes if you can get this fancy thumb brace in either immediate care center, orthopedic surgeon's office, then you might be able to get by with immobilizing the thumb so there's no movement at all. If there's no movement, then you have rest. If you have rest, you have a speeding up of your inflammation resolution. So as most of you know, I try to take the disease process, and I trust that if you're healthy, the disease process will go away on its own. You'll be able to fix things and mend things on your own. If you're unhealthy, or if you have vitamin deficiency, if you don't eat right, then fix that. Either get on a better diet, take a supplement, or get off of gluten, dairy, and wheat. Sometimes that speeds up the healing process so your body can fix itself. Icing is always important, and as long as you can get ice to this area and not burn the skin 3 times a day at least, or in the acute phase every hour for about 10 minutes. Something like ice will decrease inflammation, and then when you take the ice off, it actually causes a rebound increase in blood flow. Anti-inflammatory herbs like turmeric, or if there's joint pain also, glucosamine sulfate, very important. Topical medicines or topical herbs, supplements like tea tree oil or helichrysum are also important on a 3-time-a-day basis. I think magnesium always helps with inflammation. Again, it depends on if you have proper kidney function. If you don't have good kidneys, then taking too much magnesium will build up toxic levels very quickly, so you have to be careful and ask your doctor about that one. The final thing is, if we don't have great results with regards to conservative treatment, then we add prescriptions, as I mentioned earlier. You can go in the form of an oral anti-inflammatory that is standard over the counter like ibuprofen, or you can go prescription anti-inflammatory. You can actually go with a solution of anti-inflammatory called Pennsaid. Pennsaid is 20 to 30 drops of a topical Voltaren. You apply it 3 times a day. And it gets to the area of inflammation by avoiding the stomach. So sometimes if you have reflux or ulcers, or you're needing to take Prilosec, Prevacid, Tagamet, Pepcid, Zantac, those are signs that you probably won't tolerate anti-inflammatories by mouth, so a topical alternative is probably wise. And we can always send you to physical therapy as well. Physical therapists can work on applying electricity to the area, low dose, applying steroids or just ultrasound through the skin. Even an acupuncturist should be able to take advantage of moving energy and getting this thing to heal up properly. I've had great results with using acupuncture needles and turning this around. Again, because of my integrative medicine background, I usually use both. So whether I use prescription medicines, injectable steroids, topical steroids, oral steroids, or acupuncture needles, gua sha, or any form of herbal solutions for improving the healing process, it's all to compress the time frame of healing. Again, one of the most important things is to make sure there isn't anything going on inside, and that's why I have to say all these suggestions are fine, but you always have to ask a professional just to make sure there isn't any bone problems. The one caveat with going conservative and not seeing anybody is, if there is a history of trauma and you've damaged the scaphoid bone in here, that can be irreplaceable, and to the point where eventually in 5 to 10 years you'll need to have the scaphoid bone replaced. You cannot mess around with that. That's when x-rays, sometimes an MRI is necessary. But altogether, that's the typical problem that I see with Dequervains Tenosynovitis to this area of the wrist, typically found in moms, but not always limited to them. also found in anybody that does any repetitive wrist work. Hopefully this helps in speeding up your healing process.